mesotherapy. And for those of you, again, who don't know what mesotherapy is, I will reiterate because I think I already did earlier in this video, but if I cut this video up, that means you probably didn't see the other video. So go check out the other videos when this gets cut up, or maybe keep on watching if this is in the fuller version of this video, right? Anyway, mesotherapy is the injection of pharmaceuticals directly into the skin. Here, we're going to be focusing on the injection of dutasteride, possibly with some sort of solution or saline of some kind, directly into the scalp. So with that being said, we're going to be looking at the study titled, quote, "Evaluation of the effect on injection of dutasteride as mesotherapeutic tool in the treatment of androgenetic alopecia in males," unquote, by Nagat, Sabhi, et al. And in this study, there's a comprehensive investigation into the efficacy and safety of mesotherapy using dutasteride for treating AGA, or androgenetic alopecia. This study involved 90 male participants between the ages of 18 and 55, and they were selected on the basis of strict inclusion and exclusion criteria to ensure a focus on the effects of dutasteride without interference from other factors like possibly having other forms of alopecia, and possibly using other drugs like minoxidil or finasteride. So patients were divided into 3 groups. Group A received mesotherapy injections of pure dutasteride. Group B received dutasteride containing solution injections. Now, expanding on this part a bit more, the solution consisted of the following. You had dutasteride at 5 milligrams per vial, so standing in at a 0.05% concentration. There was also D-panthenol at 500 milligram, and you may know this as provitamin B6, and this is commonly used in skincare products for moisturization as well as wound healing. Provitamin B6 also plays roles in synthesis of coenzyme A in the body, which is involved in numerous enzymatic reactions important for metabolism of fats, carbohydrates, and proteins, but I'm digressing a bit on that part. The solution also contained biotin, 20 milligram, and vitamin B6 at 200 milligram. Finally, control group C just received simple saline injections, so nothing else. The treatment schedule was comprehensive, involving multiple sessions over several months, and the efficacy was evaluating using various parameters, including trichogram analysis and patient self-assessment. So I think it's helpful, before we proceed with the results, let's look at the protocol that the investigators went when it came to doing the injections. The initial phase saw patients receiving injections once per week for the first 4 weeks. So this is week 0, 1, 2, and 3. The intermediate phase, this was followed by injections once every 2 weeks for 1 month. So week 5 and week 7. Now the maintenance phase. Finally, patients received injections once per month for 3 months, so weeks 11, 15, and 19. So now, what did the results show? Well, the results indicated a more pronounced improvement in Group B, which received the dutasteride-containing solution and the additional additives. This suggests a potential synergistic effect of hair growth promoters in the solution or the influence of dutasteride concentration. A significant increase in the anagen phase, also known as the growth phase, hair percentage, and the hair shaft diameter was noted in the actively treated groups, indicating the effectiveness of the treatment. However, this improvement in hair growth parameters did not always correlate with patient satisfaction or clinical observation, which is kind of weird. And this could highlight the subjective nature of perceived hair loss improvement. So maybe some people had higher expectations than they should have. The study also carefully monitored side effects, particularly concerning sexual function and spermatogenesis, and that is how sperm is created. They wanted to see if anything was wrong with the sperm and its, health. While no significant sexual side effects were reported, there was a decline in semen parameters that was observed in the actively treated groups, albeit it was within normal ranges. So they had a decline from the beginning. Their jizz showed more sperm in the beginning, and then towards the middle of treatment and the end of treatment, there was less jizz and little spermies running around in it. However, it was still within a normal range. Sorry for being immature. This happens when you've been recording for like 3 hours. You kind of just get a bit tired. But in any case, this could be indicative of there being some sort of systemic exposure, but I guess you have to expect it if you are indeed injecting dutasteride deeper into the scalp. Some of it's probably going to get into the bloodstream. Now, what I wish they did was do like some sort of scalp biopsy to show the decline in DHT. That would have been a nice additive to some of these studies, but they don't do that shit. And this is what I also want to build on though. Just because dutasteride could have gone systemic doesn't mean that this is a failure. There are other reasons why you may choose to go with topical solution or an injectable solution of dutasteride. And again, here's the case. You want to have a more localized effect on scalp DHT. So if you do get a degree of systemic absorption, again, if they did do that biopsy like I mentioned before, I'm sure it would show that scalp DHT levels have gone down significantly. Now, there is a potential with mesotherapy that because you're introducing a large degree of dutasteride to the scalp, and because dutasteride will have a long half-life and presence in the scalp, you could conceivably conclude or see, and again, I'm hoping there are more studies on this in the future, that show a even greater decrease in scalp DHT compared to the 2.5 milligrams of dutasteride per day that shows that scalp DHT goes down by 80%. Who knows, with mesotherapy dutasteride and the fact that it's used infrequently, right, it could be the case that it has long-term sustaining effects and it reduces scalp DHT incredibly. Maybe by 90%, maybe by 99%. We don't really know because there aren't that many studies that are even conducted using mesotherapy dutasteride. So yeah, this study by Nagat, Sobhi et al. Is not perfect by any means, but its retrospective design, which relied on existing records and observations, could have also introduced biases and limitations in the data quality and completeness. This design is generally considered less robust than prospective randomized controlled trials. The absence of information regarding whether or not this study was blinded could introduce bias in the assessment of the outcomes, as both patients and researchers might have a preconceived notion about the treatment's effectiveness. Another critical aspect is the study's duration of follow-up. It may not have been long enough to fully assess the long-term efficacy as well as safety of dutasteride mesotherapy. Understanding the long-term effects and sustainability of treatment is vital in evaluating the treatment for androgenetic alopecia. Regarding the statistical analysis, the study employed various tests, but these might have had limitations, such as how potential confounders were handled and the statistical power to detect differences between groups. Lastly, again, the generalizability of the study results is constrained by its specific demographic and geographic setting, so the study doesn't really talk about other groups like women, so it would be kind of hard to make conclusions about, let's say, how topical or even mesotherapy dutasteride would potentially perform in women. Now, there is another study that includes women that we will be touching on next, but I just wanted to include that for continuity purposes. So, in conclusion, Sagat Sobhi et al.'s study on mesotherapy with dutasteride presents a promising treatment for male androgenetic alopecia, demonstrating effectiveness in improving hair growth parameters. However, the potential of systemic absorption and its implications, particularly on spermatogenesis, as well as possible sexual function, necessitate further research. Now, we know from the dutasteride clinical trials that people that take this, typically their semen volume on dutasteride goes down, but in terms of sexual adverse events, it's very similar in terms of safety at 0.5 milligrams of dutasteride compared to 5 milligram and 1 milligram of finasteride. Now, for me, when it comes to studies, I would give this an okay rating, as it does have decent control mechanisms and 90 participants, although small for some people, I think it's enough to show comparative differences. Also, this study did have 3 different groups, one of which, and I think we have to applaud the researchers here, being a placebo-controlled group to help make measured assessments. Although, I do wish that this was a double-blinded study to both researchers and patients. And again, next time, when anyone is doing mesotherapy injections, please, 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 please get some scalp biopsies before and after such treatments, because it would be nice to observe how much the scalp DHT goes down by. That would be nice. And don't only get the measurements, these biopsies rather, from just the hairline or one spot of the scalp. Get it in all regions of the scalp. Hairline, the back of the head, parietal region, crown, temples. Just please get that, because that would be very valuable to know what is actually going on with scalp DHT in mesotherapy injections of dutasteride. That's fantastic. So now we're going to be looking at, in the next segment, mesotherapy using dutasteride for female patients with androgenetic alopecia. So this is going to be for the ladies. Hopefully, you can appreciate that, fellas.